Dr. Melissa Lem is a Vancouver family physician and also past president of the Canadian Association of Physicians for the Environment. She is also co-founder of PARX, which is a movement to encourage healthcare professionals to prescribe nature for a whole host of illnesses. Dr. Lem is an internationally recognized leader in the field of nature and health. I first talked to you, Melissa, in 2022, and I think that this was really starting to get off the ground. And I remember at the time, one of the very first things you were doing was prescribing free passes to some people to a few of the Canadian national parks that had opted in.
That's right. In January of 2022, the PARX program announced its first collaboration with a nature forward organization, PARX Canada, where prescribers could prescribe free PARX Canada Discovery Passes that would give the patient free entry to any PARX Canada place across the country for a whole year. And that set off this wave of international and national attention that led to us having that conversation in 2022.
Yeah, it was so interesting because at the time I didn't know. I mean, and we were talking before the interview about the kind of neighborhood I live in where nature just surrounds me to begin with. So part of you getting involved was I grew up in Toronto, so I was interested. The part of you getting involved was that you were working in northern BC, ergo surrounded by trees, and then you moved to Toronto.
That's right, Janice. I grew up in the suburbs of Toronto, and a big part of my nature connection story has to do with growing up feeling like I wasn't connected to my community. I grew up in a majority white neighborhood. My parents are immigrants from China. And because we looked different, because we were just a handful of racialized families within the community, we stood out, and I was bullied on the playground and on the street sometimes. My family was subject to racism. But it was in those nature spaces, in my dad's huge vegetable garden and our fruit trees in the back, in the park down the street, in the camping trips that we would take when we were kids. There are 5 kids in my family. So my dad is a retired public school teacher, but they would take us, my parents would take us in our station wagon and drive up to Bruce Peninsula National Park to have an amazing outdoor experience, camping experience with the family. It was in those spaces and in those experiences that I found a sense of belonging. And this really carried through to my adulthood and to my medical practice. As you mentioned, my first job was as a rural family doctor in northern BC, where I was immersed in nature, in forests and mountains and misty rivers. And after about a year or two, I moved from that setting, which was challenging in terms of medical practice, but really good for my sense of well-being because of all the nature, which I didn't realize at the time that there was research behind it. But I moved back to Toronto, young in St. Clair, concrete and glass, minimal views of anything green, and found myself experiencing nature deficit. And that led me to discover the evidence base behind the health benefits of nature, because of course, if you're a physician, the intuitive sense you have that something's good for you can't be real unless it's backed up by randomized controlled trials. To our detriment, unfortunately, I think we could be open to other kinds of knowledge more. But when I found that evidence base, it really blew my mind. And I thought, wow, no one is talking about this. I definitely didn't learn about this in medical school. Imagine if more health professionals and government and everyday people knew about the health benefits of nature. Imagine how happier and healthier we would be. And so that set me on my journey to connect with BC Parks Foundation, of which PRX is an initiative to launch Canada's National Nature Prescribing Program.
Did you come up with a lot of resistance in the medical profession to the idea of nature? Because like you said, it is evidence-based, but not, I don't think, in the way that trials are done for drugs and medical procedures. So I wonder if there was a little bit of resistance from the medical profession saying, hey, and yeah, nature,
Believe it or not, Janice, there was a lot more support for the concept than I thought there would be initially, because I thought, okay, this is an evidence base that many people don't know about. There are a lot of physicians who can be resistant to new information. If they don't already know about it, they feel like it's not valid. And I do remember some of those early meetings with some organizations meeting with their boards or their leadership, and there being one doctor kind of sitting there with their arms crossed, kind of with a very skeptical look on their face. But after we did gain endorsements from BC family doctors, from nurses and nurse practitioners of BC, and then with some amazing colleagues in Ontario, the endorsement of some major organizations within Ontario, health organizations. Once I think people see that other major health organizations are endorsing something, it becomes a lot easier for them to come on board. So it was really those early leaders within the healthcare system who understood the concept and who got behind it and who endorsed the program early on that paved the way for physicians and healthcare professionals in other provinces to be able to approach their health organizations and gain those endorsements that allowed us to launch across the country.
So yeah, so PARX are actually prescriptions written out by doctors with sort of a plan, which we're going to go into a little more detail on. But what qualifies as nature? So I think one of the things is 120 minutes a week in nature to get the
That's
most
right.
benefits. So what qualifies as nature?
The program has a standard recommendation based on research that you spend at least 120 minutes in nature each week, at least 20 minutes each time to experience the greatest health and well-being benefits and also the greatest cortisol drop, your primary stress hormone that drops the most between the 20 and 30-minute mark based on the research. But it's a process where a health professional identifies a patient with the need for a nature prescription, and really it could be any condition. The evidence base indicates there's almost no health condition that nature isn't good for, and then works with the patient to figure out how to fit nature time into their everyday lives, whether it's during social time, whether it's during their commute to work, whether it's during their relaxation and recreation time, and then writes out that prescription on the standardized nature prescription file and hands it to them or emails it to them, depending on how they're interacting with the patient. And this unlocks a number of benefits that the patients can experience, not only with everyday nature experiences, but also with the partnerships that the program has with PARX Canada, with different conservation authorities across Ontario, with the Canadian Museum of Nature, with Vancouver Art Gallery. So you can have an indoor nature-inspired art or cultural experience for people who might have trouble rolling or walking down a trail. The program's really trying to make nature as accessible as possible for everyone.
So I'm sure you know about the 330-300 concept, which is 3 trees visible from your home, school, or workplace, 30% tree canopy cover in every neighborhood in your community, and then 300 meters to the nearest park or, larger green space. Does this
Yes.
qualify? So if you can see, if your only ability to connect with nature is to have 3 trees that you can see from your home or from your workplace, does that qualify as nature?
If you feel like you've had a meaningful experience in nature, and this is something that prescribers will explore with patients, what is a meaningful nature experience to them, then you will experience the health benefits. And it's interesting because in Canada, we're lucky to have access. Many people are lucky to have access to big, beautiful outdoor green and blue spaces, huge national parks, beautiful provincial parks, in some cases, beautiful, big, beautiful urban parks. But not everyone has access to that, as you mentioned, particularly if, say, you have mobility issues. Say you're in a long-term care facility and it's harder for you to go outside. So we can find those moments of nature connection in unexpected places. It could be in the trees with the leaves swaying outside your window. It could be in a house plant or kind of an indoor garden that you might have. It could be even listening to the sounds of nature or looking at photos of nature on your walls or smelling the smells of nature. There are these volatile organic compounds called phytoncides that trees and plants release that fight off fungi and bacteria in nature with the trees and plants, but in humans, being exposed to them actually boosts your immunoproteins and your level of natural killer cells, which fight off viruses and bacteria. So if you feel like you've had a meaningful nature experience, you will experience those benefits. And there's research to back up that idea that your subjective perception of if you've had a meaningful nature experience and a nature connection is actually more important than the objective biodiversity in the area.
Well, that is interesting because I do, as I said, I live in a heritage district and we have trees on my street that are 100 years old and very mature gardens and flowers, and it's really beautiful, and a park at the end of the street. So I'm very, very fortunate. But I will say that I have my first ever plant on my desk, and I've personalized it. It's a boy. I don't know why. And I talk about how much he needs care and I think he needs water. And I just did that naturally or organically because I'm caring for it. And it doesn't survive unless I care for it. Therefore, I guess, and it's become important to me every day. And I remember that this time of the month, I have to water the plant and can't have too much light because it's more tropical. And so I've learned all of these things about my plant on my desk. So that alone, I can see can help someone. It's interesting how, but that I know that with the prescriptions, it makes people more likely to participate and engage with nature because it's interesting. Again, where I live in Niagara, and I saw that Niagara PARX or NPCA, so Niagara Conservation Authority, is part of a partner with you. I have a horse. I live 15 minutes up the Niagara Escarpment to get there. I live 5 minutes to the beginning of the escarpment. And I talk to people who have never been up the escarpment. They've never heard of Effingham Road. And it astounds me that you could live in. And when I heard that, I started to really notice. And I thought, how do people not know this? Mm-hmm. But if we get then to what the prescriptions are, I'm going to go to your website so that I get the 5 steps right. So there's 5 steps. First of all, who is allowed to prescribe nature? What's the requirement for somebody prescribing nature?
Any regulated health professional in any province in Canada can prescribe nature through the program. So it's not just doctors, it's also nurses and dentists and physiotherapists and psychologists, dentists, pharmacists. So if you're a regulated health professional in any province in Canada and you're listening to this conversation and are interested in registering, you can head to the website Janice mentioned, parcprescriptions.ca. There's also a program within Quebec called Prescrit Nature, and you can register to prescribe nature through the program.
Yeah, like the psychologist can do it because this is a show about mental health. And I think that the reason I connected with you the first time was the benefit on someone's mental health of being in nature and the quiet and that makes just jumped out me that it makes so much sense. So if you go to parcprescriptions.ca and you are a healthcare provider, there's lots of information in there. And one thing is the 5 simple steps for creating an individual prescription for one of your patients. So the first one is be the change.
Right.
And what's that?
Well, there's evidence showing that if a healthcare professional actually shows their patients that they are engaging in a certain behavior, that the patient is more likely to carry out that same behavior. So you can talk about how you're spending time outside. You can have a picture of yourself outside in nature on your desk or your hiking boots kind of in the corner so that they can see visual evidence that you're practicing what you preach. And that could increase their motivation to change their behavior and fill their own nature prescription.
So you have to walk the walk, literally.
Exactly. And it's good for you too, right? It's not just about motivating your patients. It's about making sure your mental and physical health are good so you can do the important work of caring for people's health.
Yeah. Make nature the 4th pillar of health. And I think this is something that you've been working on from the very, very beginning.
That's right. So every time I counsel a patient about healthy diet, exercise, and sleep, which are commonly recognized as important pillars of preventative healthcare that have to do with lifestyle, I will mention nature time. I'll ask them and explore with them how much time they're spending outside and how meaningfully they're connecting to nature. And so I make nature time the 4th pillar of health, just as important as healthy diet, exercise, and sleep at promoting a healthy lifestyle.
And then something that we've talked about, which is the personalizing it. So I'm going to skip over that because we've talked quite a bit about that, and the scheduling it. And I think that this is important because it's very hard for people to follow a schedule to begin with. But I would think that this is a little more difficult.
Yeah. Well, sometimes people need things written down in order for them to remember and to motivate them to do them. And there is evidence showing that if you write something down, you're more likely to actually carry out that item on your schedule. We're busy people, right? We have jobs, we've got families, some of us, we lots of us have lots of kind of recreational opportunities that we engage in that aren't necessarily nature rich. But if you actually take the time to schedule it in, like a dentist's or a doctor's appointment, you're more likely to make it happen.
Okay, and then the person, this is the important one, I think, based on following the schedule, is that the person, the health professional that prescribes you nature should follow up, because
That's
then you're
correct.
accountable.
That's right. Yeah. So just like if I prescribe a medication or if I make diet or exercise recommendations, when I issue a nature prescription, next time talk to the patient, I will ask them how they're doing with their nature prescription and give them ideas for how they can fill it. There are a number of partnerships beyond the partnership with PARX Canada that you mentioned with different conservation authorities, but there's a partnership with Vancouver Art Gallery in Vancouver where you can have an indoor nature-inspired art experience, or the Canadian Museum of Nature where you can check out their indoor nature displays. So if you have trouble rolling down a trail or with mobility, or if there's a heat dome outside, or if it's smoky, you can experience nature in a different way, and just to make sure it's accessible to the largest variety of people possible.
Now, thankfully, a lot of communities, including this one, are realizing that trails and things like that should be accessible to everyone, which goes to the 880, there's something in the middle there, concept that everything should be accessible to someone 8 years old to 80 years old. And then the accessibility issues, like you say, with wheelchairs and other mobility, and being able to travel to, just having the public transit or the car or whatever it is to travel to nature. So it's really interesting that you can go inside. I want to just ask you, and this sort of deviates, and we have a couple of minutes, but I read last week about seasonal affective disorder for the summer. And I was really intrigued by that because we all know, I think everybody, pretty much everybody knows about seasonal affective disorder in the winter. And that was, I think in the mid 80s, that was recognized by the medical profession. But in the summer, we're all supposed to feel good. The days are longer, it's warm, but I was thinking a couple of weeks ago, I thought, I don't know why, but I think I'm starting to feel depressed. Like I don't want to go out, I don't want to do things. And I think it's partly because it was either raining or it feels like, 40 degrees with not too many days in between. And so when the nice days came, I still didn't want to go out.
Mm.
And
Was
it's
it
become a real thing.
That's right. So seasonal affective disorder, as you mentioned, doesn't just happen in the darker months. It can happen with the transition to summer as well. And it's those very factors that you mentioned. In fact, the higher light levels can throw off our circadian rhythms and interfere with our sleep, which can affect your mood. Also, the heat and humidity that we experience in the summer is hard on our physiology, hard on our mental health, and can also affect how we feel. And then that feeling like you should be happy, like you should be getting out there and having fun with your friends or your family when you don't necessarily feel that way can make you feel like you're missing out on things. So there are a number of reasons why you can have SAD in the summertime. The symptoms can differ a bit from SAD in the wintertime. Often, instead of being really tired, like in the winter, you can have trouble sleeping. In the wintertime, often it's characterized by wanting to eat a lot more. In the summertime, often you lose your appetite. So different symptoms, but overall the core is just feeling down and depressed because of a change in the light and the season. But I think gently heading outside into nature, looking out at nature out your window, taking your time to spend time outside, sitting under a tree in the shade instead of in the full sun, which can be kind of overwhelming, could be ways to ease yourself out of SAD. But if you are experiencing severe depressive symptoms, obviously speak with a health professional.
It's funny because I was about to ask you what you can do to help with your seasonal downs, and of course, it circles us back to nature. Thank you so much, Melissa, for coming on and talking about this again. It has expanded so much, certainly since we first talked in 2022. And so it looks like it's really, I didn't go through the numbers, but the numbers, if people go to parkprescriptions.ca, you can see the numbers of doctors and medical professionals, health professionals who are prescribing nature, and the benefits and the number percentage of people who are benefiting. And it's amazing.
It's
And
incredible.
I'm sure I'm going to be talking to you. I don't know if I guess I don't need to wait until the summer. We need to have a winter discussion about what you do when it's minus 30. But thank you. I know that you're busy and you need to get back to the multitude of things that you do. And I will talk to you soon.
Janice, it's been a pleasure. Thanks.
That's great. Yeah, I never even thought about nature in the winter. Honestly, I only think, yeah, like, no, it's just like it's summer and I have to talk to Melissa Lem because I need to talk about PARX. I have to stop calling it PARX.
It's okay. Well, you look at it, it looks like parks, but yeah.
Yeah. Yeah. So thank you. And maybe I'll be in touch in the winter and we can talk again in the winter about how people get around and do that. But amazingly, the number of people I've talked to who've never been up the Niagara Escarpment, which is
It's right
in the summer,
there.
and
Yeah.
in the winter, it's absolutely stunning. So we need to get more nature people going. PARX has grown a lot over the last number of years, but it was a podcast show with two guys who had an audience of 6 million who found you by happenstance in 2022, and that shot you onto the world stage.
Yeah, well, it was 2022. It was actually that wave of Parks Canada stuff. It wasn't me. It was just the two hosts having a chat about nature prescriptions in Canada.
Yeah.
It was incredible. It
Yeah.
really created a cultural movement, I think, a cultural moment. And yeah, Canada's viewed as a leader in the nature prescribing movement. There are so many countries reaching out, asking about the knowledge that we have here and how to make it happen in their own countries. So it's
Oh,
it's
that's amazing.
exciting.
Thank you, Melissa, for joining me on the show. And if you are a healthcare provider or you just want to learn more about Park Prescriptions, go to the website parkprescriptions.ca. You can listen to all shows of Life Unscripted on your favorite podcast app or on my website at lifeunscripted.ca.